Welcome back, everybody. Now, as you've just seen, we are going to have the following conversation is going to be about Breast Cancer Awareness Week. This morning with me is Dr. Nazreen Bhim, who's a clinical oncologist who recently completed training in Cape Town, South Africa. Good morning, doctor.
Good morning.
Thank you for joining us this morning. So we continue the conversation as we are commemorating Breast Cancer Awareness Week here on the Now Morning Show. So first off, tell us a little bit about yourself and your background in oncology.
So basically, I've always had a passion for oncology. I have been more interested in oncology since I was a teenager, actually. So when I completed my medical degree, I started working in oncology right away. And in 2016, I had the opportunity to train in South Africa in clinical and oncology, which basically consists of radiation oncology and chemotherapy for all disease sites.
Now, with your, you said since you were a teenager, you wanted to go into that. Is there any personal reason why you wanted to go specifically into oncology?
Well, actually, my dad was one of the first oncology nurses that was trained in oncology in Trinidad and Tobago.
Wow.
And back in those days, you always, the parents would have you sitting in the car or loitering in the corridors while they work. So because of that, I had a bit of exposure to his experience at the public health sectors in oncology. And I, just from that personal experience and seeing patients, I felt like there was so much that could be done in the field. So that's the reason really why I had an interest in oncology.
Now, you practice things like chemotherapy and radiation therapy. Could you tell us what each one is and the purpose of each one?
Okay, so I usually use a very nice analogy when I have to explain, the concept of oncology treatment to patients on the whole. So how I like to describe cancers when I have to describe treatment to patients would be that I would relate the cancer to a business. So say, for example, you have a business and that's growing in a tree. Then basically the first thing for most cancers that we have to do is that we have to cut the cancer out. That's most cancers, right? There are some cancers that we don't need to do a surgery for. In that case, that's the same concept as breaking down the business. Now, if you break down the business, say it was growing on this little branch in the tree, and you don't want it to grow back in that one particular area, maybe you might go and you might, say, okay, we're just going to cut this branch off, or it was growing on a nail. I'm going to take this nail off of the tree. Basically, that's the concept of radiation therapy. Radiation therapy prevents the cancer from coming back in the same place. It's localized treatment, only targeted at the area where the cancer was to prevent it from coming back at the same place. And this is when we're talking about initial cancer treatment and curing cancer. There are other indications for radiation, but this is just, for a patient who came in and was told that they have to have radiation. It's to minimize the chance of the cancer coming back in the same place. Now, when you break down that bee's nest, sometimes you have one or two bees that may fly out of the nest and decide that they're going to go and build in other areas of the tree, or they perhaps want to go and build in other trees. Now, in that case, what you'd do is that you'd say, okay, I'm going to spray this entire area so that the bees don't come back and prevent them from building new nests. And that's basically what chemotherapy is. So chemotherapy is systemic therapy. It passes through the entire body and it minimizes the risk of the cancer coming back in other places.
Now, these two forms of therapy, are they done at every stage of cancer, or are they for specific stages, more so late stage?
So basically, cancers on the whole, the main treatment options are surgery, chemotherapy, and radiation. And most patients will have some combination of these modalities. When I say chemotherapy, I really mean systemic therapy. So systemic therapy can be chemotherapy, but now in current time, we have other types of treatment that are systemic, such as immunotherapy, which is, a completely different concept, but also systemic therapy. And then there's also hormonal therapies as well. So basically, the cancer treatment will involve a combination of surgery, radiation, and systemic therapy that's going to be targeted for the particular type of cancer and the stage that the cancer is. Not every patient will need all three modalities for every type of cancer. It really depends on the site of the cancer and also the stage that the cancer is at to determine which of these combinations would be needed.
Now, some people are a bit fearful of the named side effects of chemotherapy, well, systemic therapy, and radiation as well. What are some of the things that can occur as a result of these both types of therapy?
So chemotherapy has many side effects. Again, it depends on really which type of chemotherapy, because each one of them does have a different side effect.
Right.
You know, there are many medications that we use now, pre-medications and during the treatment while patients are having chemotherapy. We have drip chemotherapies and we have chemotherapies that you can take by mouth as well as tablets. Now chemotherapy hasn't evolved from the way that chemotherapy was 30 years ago.
Okay.
And most of the drugs that we have now do not have a lot of the toxic side effects that was described previously. And even with the side effects, they're much more manageable now. We do have many more medication that we can use to control side effects in patients receiving chemotherapy. One of the big ones I think that most patients are always concerned about is hair loss. Many of the drugs that do give chemotherapy, many of the chemotherapy drugs do cause a bit of hair loss. Not all of them, but most of them do. And basically, chemotherapy, because as I mentioned before, it's systemic therapy and it passes through the entire body. The chemotherapy has effects throughout the body. It targets developing cells and especially rapidly developing cells.
Right.
Normal body cells are able to regenerate and repair themselves. So you'd find that during chemo, you might have a lot of side effects relating to maybe other parts of the body, other organs like your blood counts, your red cells, your platelets, things like that. But what you'd find is that over time, the body is able to repair itself and go back to baseline. But the cancer cells, they lack that repair mechanism. So they are the ones that tend to not be able to regenerate when we give chemotherapy.
All right. Well, doctor, with that one, I want to thank you so much for the education and the lesson in the various types of therapy in dealing with cancer. And with that, I want to say thank you very much for joining us this morning as well. All right. So that was Dr. Nazreen Bhim, who is a clinical oncologist. And, I'm very happy for that information this morning. Have a great morning.
You too. Thank you.
All right. And that has been for...